Hi, Brian Byers. We're here with HSHS Medical Group, and today we're talking to Carolyn Wagner, nurse practitioner at St. Mary's Family Medicine in Forsyth, which I understand is right across the highway from the mall, so very easy to find.
Yes.
All right, before we talk about the practice, let's talk a little bit about you. Tell us, where did you go to school? How did you get into this field? Did you know at a young age you wanted to do this?
I knew at such a young age I wanted to do this. I'm the little girl with the nursing uniform and the doctor's bag and running around taking care of everybody. But right out of high school, I became an RN, went to Lincoln Land, worked as a nurse. It's 36 years now almost. And about halfway through, I decided I wanted to go back and get my master's and become a nurse practitioner.
Okay, explain to the folks, the terminology has been around a while. I think people, when you say nurse practitioner, they're familiar, but I'm not sure they know exactly what a nurse practitioner does.
What we do? Well, we do expanded role of nursing. Basically, we're still registered nurses, and we are able to diagnose, assess patients, treat them, prescribe medication, order tests, refer to specialty.
So back in the day when, mom had a sick kid and they had to wait a week to get in to see a doctor because there were more sick kids than there were doctors, this opens up access to healthcare and to medicine in a large way. In
a very large way, unlike what we have ever had before. So yes, nursing has stepped up to the plate.
Walk us through a day in the life. You're out in Forsyth. What do you see? What is it like?
A variety, all ages, because I'm family practice. So I will see anywhere from newborns to patients in their 90s, maybe patients who are in with a quick sick, sore throat, cough, etc., or the patient who has chronic illness such as diabetes, heart disease, hypertension, asthma, manage their chronic health state.
Okay, it's amazing. You went to school, you said, here, at Lincoln Land. Were you born here in Decatur?
Yes, I was.
All right, so you're a home girl.
Yeah.
And decided to stay in the community. I assume this career could have taken you elsewhere.
Well, I was in California for a little while. Kind of sought my fortune there, and came back home.
And why did you come back? Why choose Decatur?
Family ties and a place to make sure the kids were raised. Really wanted to be in that same location.
Sure. HSHS Medical Group and all the locations and with the doctors and the nurses and nurse practitioners, there is that sense of family at work as well, right? Tell me about those relationships and what it's like to work with those people every day.
It's great to work with them. It's really like being home, and it's a very supportive group. I can pick up the phone and I know that I can talk to any of our collaborating physicians that we work with and our subspecialty people. And it's a nice...
Fantastic. Tell me a little bit about your family. You mentioned your children.
Yeah, well, we have 5 girls.
Okay.
We're the parents of 5 girls. We have 2 granddaughters and a grandson. And we just, stay busy as a family. We love to travel.
People make decisions, based on their health care, I think, on their comfort level. They like to get to know people. I personally think nurses run the entire medical profession anyway, but their bedside manner, the way they're able to relate to patients, the fact that you can treat the whole family. Why should folks, if they're looking to make a change, should they look at St. Mary's Family Medicine in Forsyth?
Well, I think we have everything that a family needs. We are able to care for all age groups, and we certainly have that nursing portion as well, especially at Forsyth. I'm the full-time nurse practitioner out there, and that's my gig, and that's what I love to do, and it's my passion.
All right, St. Mary's Family Medicine, 133 Barnett Avenue in Forsyth, right across from the Hickory Point Mall. Carolyn Wagner, nurse practitioner, thank you very much.
Thank you.
For HSHS Medical Group, this is Brian Byers.